You've probably heard the term diverticular disease thrown around, right? It affects a ton of people, but honestly, there's a lot of confusion about what it actually is. So in the next few minutes, we're going to clear all that up.
Okay, so let's just dive right in. What are we looking at here? These are small pouches, called diverticula, that can form in the wall of our intestine. But why do they form? And what are they exactly?
So first things first, to really get what's going on, we need to understand the anatomy. What exactly are these little outpouchings?
I want you to imagine a tire with a weak spot. If you put too much pressure inside, what happens? It bulges out, right? Well, that is a pretty great analogy for what happens in our colon. When pressure builds up, it can push the inner lining out through naturally weak spots in the colon's muscular wall.
So what does it mean to just have these pouches? This brings us to the first condition, and it's a big one: diverticulosis.
And this is absolutely the most crucial point to get. Just having these pouches is called diverticulosis, and for the huge majority of people, this condition is completely silent. It causes no problems whatsoever.
So you might be wondering, what puts you at risk for developing these? Well, age is a big one. Our intestinal walls can just weaken over time. But you know what? Lifestyle plays a massive role, especially a low-fiber diet. That can lead to straining, which causes that increased pressure in the colon we just talked about.
In fact, and this is wild, most people with diverticulosis have absolutely no idea they have it. It's often just found by accident during a scan for something totally different. It's a silent condition until it's not. So what happens when these quiet little pouches stop being so quiet? When they get inflamed or infected? Well, that's when the condition becomes something way more serious: diverticulitis. See that itis at the end of the word? That's always your clue in medicine. It means inflammation. This is the moment the condition goes from just being there to being an active, painful problem.
And unlike its silent counterpart, diverticulitis definitely lets you know it's there. The classic sign is a steady pain, almost always in the lower left part of the abdomen, along with all the other fun signs of an infection.
So let's just boil it down. Diverticulosis, that's just the presence of pouches. Diverticulitis, that's the inflammation of those pouches. It's like the difference between having a pothole on the street and a car actually crashing into it.
Okay, so how can doctors possibly tell what's happening and confirm whether it's one or the other?
Well, imaging is everything. They gotta get a look inside. Things like this barium study you see here, or more often a CT scan, let doctors literally see the pouches and, more importantly, any signs of that nasty inflammation. All right, so you've got a diagnosis. What's the plan? The treatment path is completely different depending on if you're dealing with the quiet diverticulosis or an active flare-up of diverticulitis.
The way it's managed follows a really clear stepped approach. For just plain diverticulosis, it's all about prevention. A high-fiber diet is key. For active diverticulitis, the goal is to treat the infection with antibiotics. And then, only in really severe or complicated cases does surgery even enter the conversation. So if you remember one thing from all this, let it be this: osis is just having the pouches, while iditis is the actual problem. Knowing that single difference is so empowering because it helps you focus on prevention and understand when it's time to call a doctor.
And that really brings us full circle, back to the power we have in our daily choices. It's a pretty clear reminder that what we eat every day isn't just about how we feel right now, but about building a stronger, healthier body for the long haul.